Hello, I'm Joel Straza, Health Officer with the Bay County Health Department. Today is Tuesday, January 5th, and this is your weekly COVID-19 vaccine update. As of this week, we are starting to register and provide vaccination to everyone in the 1A tier priority group. That includes all frontline healthcare workers, whether they're at the hospital, whether they're in doctors' clinics and providers' offices, or any other medical provider throughout the community. This also includes EMTs and first responders. We are taking registrations right now through our county website. So please follow the link below if you fall into this category. Once you register, you will shortly receive a confirmation email that will invite you to a community-based clinic. Please respond to this as soon as possible. It may take a few days after you register for that email to come, but please be on the lookout for this and we will get you the vaccine as soon as possible. We are soon going to begin 1B vaccinations, and 1B vaccinations include all critical infrastructure workers as enumerated by the state of Michigan and persons 75 and older. Now, there was a great deal of confusion earlier this past week about a phone registration system, and we are working diligently to get a robust phone registration system in place that will effectively be able to register folks for these vaccinations. But if you have access to the internet, you don't have to wait. You can register on the county website via our SurveyMonkey link found below. Now we'd like to do some frequently asked questions about the vaccine. At this time, the Bay County Health Department has a limited supply of vaccine. And since the middle of December, the Bay County Health Department and McLaren Bay region have begun vaccinating workers in the 1A category. And this includes all frontline medical providers. McLaren is vaccinating everyone on their behalf in the McLaren universe, and we are trying to attempt to vaccinate all 1A workers, medical workers, that do not have an affiliation with McLaren. And this is quite a daunting task. We have over 1,000 people in the queue waiting to get vaccinated. So please be patient. Well, in order to effectively free ourselves of the restrictions that we currently face, we must achieve herd immunity. And that means approximately 70% of the Bay County residents need to be vaccinated for COVID-19. That is, in plain numbers, 72,000 people. Right now, the vaccines that are available require 2 shots or 2 doses. So that actually requires about 140 or 144,000 doses total. And in order to do this by July 4th, which is our goal, we need to work with a whole army of providers, every provider in Bay County, in order to do so. Presently, the only type of vaccine in Bay County is the Pfizer-BioNTech vaccine. It's an mRNA type of vaccine. It requires 2 doses, 21 days apart. We've given out well over a few thousand shots total here in Bay County between the Bay County Health Department and McLaren Bay region. And I'm happy to say that so far we have not had anyone with any adverse reactions so far. Well, part of that is going to be there's usually, if there are any side effects, you might have a sore arm, you may have a headache in 24 hours following that, you may have a slight fever or feel malaise or tired or fatigued. Very rarely does anyone have any type of significant side effects other than that. One thing that we do encourage people as they get the vaccine is to sign up for the VSafe program. It's an application that you can use on your phone, and it's really simple to do. It will ask you a few questions about the side effects that you may be having, and that information will go straight to the CDC so they can better project the types of side effects that people are having. But as of right now, for the few thousand doses that have occurred here in Bay County, we haven't had any problems at all. Yes, you can get the vaccine if you've been diagnosed with COVID-19. The only thing is we want you to be recovered when you get the vaccine. One of the key elements that we have to have in place as we provide vaccines is we still have to have social distancing occur. So if you are symptomatic, or even if you're in quarantine, we're asked that you do not come, that you reschedule your shot or your vaccine. So that's an important element. But if you've had COVID-19 and you've recovered, then we highly encourage you to get the vaccine. And actually, there are no out-of-pocket expenses for the COVID-19 vaccination. In some cases, we do ask for your insurance information so that we can obtain the administration fee from your insurance company. But that is merely so that we can pay the bill so we can provide the vaccine to you. But there is no out-of-pocket cost. So if you do not have insurance, or you do not have any ability to pay, or we're not asking for any money or anything like that. We want to provide the vaccine to you as quickly as possible. Yes, absolutely. And the reason why is, number one, while the vaccine will protect you from, we know, from having severe illness from COVID-19, it may not protect you in total from getting COVID-19 or spreading COVID-19. So you still need to wear a mask until everyone, it's universally accepted that it's a safe time that you don't have to wear masks anymore. So I want to thank you for joining me today. Join me weekly. We're going to have weekly updates and even sometimes bi-weekly updates, because we've got information changing all the time about the vaccine and the virus. And we will have more information listed on our website at www.baycounty-mi.gov. Thanks again, and I'll see you soon.